Yes. Today we are going to discuss about the fractures and their basic types, healing, and the management. And this is the very introductory or the very initial teachings in the orthopedics in the undergraduate level. So today what we are going to cover is the fractures and their basic types and how the fracture heals and what should be the management. And these all has to be covered uh, in today's slide. Okay, so the first is the fracture. Uh, or what are the goals or what are the definitions of the fracture? So a fracture is defined as a discontinuity in the bone, especially the cortex. But at the same time, one should remember that it is not only the bone which is injured. Whenever there is a trauma, along with the bone, there is some degree of the soft tissue which covers the bone at that area is also injured to some extent. Then how the fracture happened? Why? How? Okay. So the the fracture can occur because of so many reasons, which we are going to discuss after this slide. And now, what are the goals of the fracture treatment? The goals or the aims of the treatment is to prevent the fracture and soft tissue complications which are occurring because of the injury. And now, the second goal of the treatment of the fracture is to get the healing of the bone and the soft tissue in a satisfactory position, in a good alignment, and so that the recovery of the functions is 100% or back to normal, whatever it was before the injury. And the third very important goal of the treatment is the intra-articular fracture should be reduced nicely or accurately 100%, and it should be fixed rigidly. But as far as the non-articular part, diaphyseal fractures are concerned, an anatomical reduction is sufficient. But at the same time, an stable fixation is required to get the union, otherwise, a non-union may ensue. Then the last thing comes is to restore the patient's optimal functional state, and that should be as early as possible, and that can be done by means of the active and the passive exercises. Then now the question comes, one can make a question, why the fracture occurs? A person is sitting and gets the fracture? Yes, it can, but the normal cause of fracture is a trauma, a kind of a kinetic energy, which may be low energy trauma or a high energy trauma, which we are going to discuss in the next slides. And number two, the second cause of the fracture can be a repetitive stress, and that is called a stress fracture. And number third is the abnormal weakening of the bone. So there is some kind of weakness within the bone to cause the fracture to occur. The causes of the weakness of the bone may be so many, nutritional, pathological, or maybe because of the physiological weakening because of so many reasons. Now, in the case of the fracture can be caused by the twisting of the bone. How the how the twisting can cause the fracture? A person is a senile person about 70, 75 years of age is standing on his foot and suddenly turns with a stable foot on the ground and his hip gets twisted to one or the other side and can cause a fracture. Okay, and similarly, the fracture in a running person, stopping suddenly for catching a ball in a sport person, or because of something else, and can cause an spiral fracture to occur. Then there is another cause of the fracture is the compression, which causes the short oblique fracture. A short oblique fracture is the fracture in which the fracture line is about more than 30 degrees of the long axis of the bone. Then the bending can cause the fracture. Then there is a sudden bending in case of a trauma or a heavy weight falling on the stooping person on the back can result in the fracture of the neck of the femur or trochanteric fracture. And at the same time, if the bone is bending in a lateral direction, then there can be a small butterfly fragment or a free fragment at the site of the fracture. Then there can be a tension bands, tension fracture, and that tends to be a fracture line tends to be transversely or 90 degree to the long axis of the bone. Then the types of the fracture according to their shape or their geometry. You are seeing on the top of the left hand, the normal bone, the femur is looking. Then you have got a transverse fracture because the line of line of geometry of the fracture is transverse or the 90 degree to the long axis of the bone. Then you have got oblique fracture where the fracture line is going at an angle on the from the long axis, which is more than 30 degree, and this is called a low oblique fracture. Then you have got a high oblique fracture where the line of the fracture line goes to more than 60 degrees. Okay, that is the high oblique fracture. Then similarly, you have a spiral fracture where the fracture geometry is in two planes, one anterior plane and another can be posterior plane, lateral plane or medial plane according to the type of the trauma which the patient has received. Then you have got comminuted fracture. Here the